Hi, my name is Dr. Jamie Geddes. The purpose of this short video is to explain the reasons for desexing and the process surrounding desexing at Ku-Ring-Gai Vet Hospital. Firstly, why desex your pet at all? For male dogs, desexing is very beneficial as it decreases the risks of roaming, fighting, prostatic disease and testicular cancer. For female dogs, of course, it removes the risk of unwanted pregnancy and associated diseases such as uterine infections and mastitis. But it's also a little known fact that in fact dogs have the highest incidence of breast cancer amongst any species, and therefore it's imperative that they're desexed at a young age to protect them from that issue in later life. For male cats, as we all know, a desexed male cat is far more compliant and avoids the risk of spraying and fighting and excessive roaming. For female cats, again, it protects them from unwanted pregnancy and the associated issues there. Therefore, in the suburban environment, we strongly believe that it's an imperative that young pets are desexed to make sure that they're happy and safe and in their environment. Making an appointment. When your pet is 6 months of age or you receive a reminder for desexing from us, please contact reception and organise an appointment Monday to Friday for a suitable time. Pre-op fasting. Dogs and cats need to be fasted from 8 o'clock the night prior to the day of surgery, and they can have a drink of water on the morning of the surgery. Dropping your pet off. We take admissions for surgery between 8:30 and 9 o'clock on the given day on a first come, first served basis. Please allocate sufficient time for this as there are a few things we need to run through with you, and they include: we need a contact number for you throughout the day. We need the time to discuss our recommendation for post-op pain management. We keep the pets overnight as a routine so that we make sure that they're happy and comfortable, their pain is minimised and they're not chewing their wound, and we'll make you aware of that. We'll check for anything else that needs to be done at around 6 months of age, such as worming, a heartworm injection for your pup, checking their teeth, hernias, these sorts of things. We will remove all dog collars, and we ask that all cats are left in a cat cage. And once the admission paperwork is finalised, we'll ask you to give us a call at around 3 o'clock that afternoon to hear an update that your pet is doing very well and to organise a discharge appointment for the following day. A discharge appointment is required so that we can return your pet to you, explain what has been done and explain any medication. The surgical process. The surgical process begins with an examination in the morning on the day of the procedure to make sure that the animal is fit and well and a suitable anaesthetic candidate. We then administer a pre-medication which contains a tranquiliser and a painkiller, so that by the time they're ready for their procedure, they're very calm and relaxed and not stressed. In the middle of the day, the patient is anaesthetised using an intravenous anaesthetic, and then the anaesthetic is continued using a gas anaesthetic, very similar to that which would be used in a human hospital for a baby. We have access to a wide variety of sophisticated monitoring equipment, including ECG, blood pressure, end-tidal CO2 monitoring, and pulse oximetry, which allow us to use any of these modalities to make sure that we have a very safe procedure. The surgery for males involves an incision just ahead of the scrotum, and both testicles are removed and the blood vessels are tied off using a dissolvable suture. The wound is then closed using both internal stitches and non-dissolvable skin stitches. For females, the surgery involves an incision just down from the belly button and surgical removal of both the ovaries and the uterus. The wound is then closed again with both dissolvable internal stitches and non-dissolvable skin stitches. Recovery and aftercare. Once the surgery is complete, the patient is monitored in the recovery area of our hospital. and given post-operative pain relief medication. And once they've recovered, they're transferred back to their hospital cage where they're monitored throughout the afternoon and evening and as required overnight, as we have overnight care. Their monitoring involves making sure that they're comfortable, not stressed, leaving their wound alone, and in the evening we provide food and water. Other medications that we may give include some cream to the wound, additional tranquilizers or pain relief, and perhaps a collar around their head to prevent any chewing. The next morning the patient is re-examined by one of our veterinarians to ensure that they're fit for discharge, and then they are discharged at the pre-appointed time that you've arranged. The discharge appointment will cover a number of things, including provision of a sterilisation certificate so that you can register your pet at the council, explanation of any medication to go home with, and we do normally recommend, particularly for dogs, that they go home with some additional pain relief. And finally we'll ask you to organise a follow-up appointment for 10 days' time. This is a no-charge recheck so that we can remove the stitches, ensure that the wound is okay, and close the case. After discharge and in the period between that and the stitches out appointment, the home care, as we'll explain, involves a common sense approach to ensure that your pet is eating, drinking, urinating and defecating as you would normally expect, leaving their wound alone and relatively happy and comfortable. If you see anything that you're concerned about, it's best to adopt a proactive approach in contacting us so that we can reassess the situation. Exercise, it's okay to walk your dog on a lead, otherwise they can get bored, but running and jumping or playing at the park, whilst the stitches are very strong, that sort of activity can induce some swelling of the wound, and so we discourage that. By adhering to these processes, we have excellent results with our routine desexing program at Ku-Ring-Gai Vet Hospital, and a high level of satisfaction with our patients' comfort. We always say that your pet will only be desexed once, and so we want this to be a happy and smooth process for both you and them. If you have any further questions, please contact us on 9449 4111. Thank you.